We do assign patient advocates to committees, and some have been more successful than others about being incorporated into the steering committee, where a lot of the originating conversations happen. We want our patient advocates to be at the table right from the beginning. We want them to have a relationship with their committee chairs. We encourage them to step up and speak up if they're a little shy and they're new. We are absolutely happy to facilitate that conversation. And so are the chairs of the Patient Advocacy Committee. So you can work through one of either way. You can work through, or three ways, through the committee chair you're assigned to if you feel comfortable. If you're not, having the Patient Advocate Committee chair advocate for you to be part of the committee you're assigned to, or come to us as the NCORP PIs, and we can help you get incorporated into the committees to which you're assigned. And then you'll hear about the concepts. It does sometimes take a little time to have the courage to raise your hand and speak up, but that's absolutely what we need you to do. We need to hear your voice at the table. Laurel, you know how to do that, and you do it so beautifully. You also have opportunities to actually formally review concepts. Laurel has long been one of our NCORP patient advocate concept reviewers, which is a very formal process. She reads the protocol, the concept, and then gives a formal written review in our NCORP. And then we take those written reviews and we sit around the table in a very formal manner, and we have each person who did a review summarize their critique or their input into the trial. And then we collectively have a discussion about those comments. And then we often ask the investigators to go back and revise their protocols based on the input we get from everyone around the table, including, most specifically, the patient advocates.
And that's our important part as far as what the part that we include in meetings, and any time in between the semi-annual meetings, we still have monthly meetings at least. And if a committee doesn't, and if you as the advocate are not receiving the information or any concepts that would be reviewed at a meeting, please ask your chair. And there should be, within the resources, there should be some information as far as we've written a letter that you can put your own information into and send to your chair. And we also would like you to know, as a new advocate, that we can mentor you so that we can help you feel more secure, because I wasn't so secure when I started either. And so my advocate that I work with now came onto the Cancer Prevention and Control Committee, and you'll find it's a lot of alphabet soup and in research, but so that's called the CPC. So when she came on, she was a little unsure, a little timid. So we just sat side by side, and we made sure that I made sure that she knew what was expected and how to go ahead and speak up, and she's just done it beautifully. So I welcome any new advocate, and I hope all of our advocates will even be more embedded in their communities. Thank you. Thank you, Dr. Bruner.
My pleasure.
Thank you.